Well, it's a hot weekend, and there's plenty of sunshine and lots of potential for sunburning, which in turn can also affect whether or not we can get skin cancer. No matter what your skin type is, white, yellow, brown, black, skin cancer can affect everyone. My next guest is a dermatologist and specializes in early detection and treatment of all forms of skin cancer. I'd like to welcome Dr. Christine Lee of Walnut Creek's East Bay Laser and Skin Care Center Incorporated. And I guess one of the first questions I have to ask you is, since we hear more about protecting ourselves from skin cancer, are skin cancer cases more prevalent or less nowadays?
It's become much more prevalent, much more common.
Much more common?
Much more common. We're actually in the middle of probably the largest skin cancer epidemic ever in history.
Is that in the United States or around the world or any particular portion of the
especially in the United States.
Really?
1 in 5 people in the U.S. Will get skin cancer at some point in their life.
Wow. I would think that for years we keep hearing about how to take care of ourselves, how to use the right kind of lotion and staying out of the sun during peak hours, that we've been more careful, but it doesn't sound like it.
People are more aware of it,
okay,
and certainly people are wearing sunscreen more. But unfortunately, sunscreen has great limitations. And we don't want to discourage people from using it. In fact, you have to wear it. It's better than nothing. But a lot of people are thinking they can stay out in the sun longer because they're wearing sunscreen.
Exactly.
And that's actually making it much worse for all of us, because the real intention of sunscreen is to prevent us from getting sunburned. And it used to be that if someone got sunburned, they realized, oh, okay, I need to cover up, go inside. Now you're not sunburned and you think, oh, I can stay out in the sun longer. And that's actually why people are getting more sun damage with their sunscreen.
Okay, so we think we're protected, so we go out and
have
more
stay
fun
outside.
in the sun.
Exactly, they'll stay outside longer.
So I have to say, we're going to go through some photographs, and I have to let our viewers know that the photographs are rather graphic of skin cancer. So you might want to turn your head or tune away, but we're going to talk a little bit about the signs of skin cancer. This is a chart, and what does this chart show us?
That chart shows us the A, B, C, D, E's of detecting melanoma, which is the most dangerous form of skin cancer. And A stands for asymmetry, border is B, C is for color, D is diameter, and E is evolving.
So those are the signs that you look for to look for skin cancer?
Yes.
Okay.
When you are looking at yourself and you have moles, people have many different lesions, brown spots, moles are very common. This will help you at least have a starting point of assessing.
Look for.
Yes.
Look for. Okay, let's take a look at the next photograph that we have. And what does this show?
This actually shows a melanoma.
Oh, now does melanoma look different from case to case, or is it pretty much like this?
No. In fact, if you see something like this, you're probably going to have a very bad outcome. Okay. So unfortunately, old people think, oh, if I have, if you saw this, you probably know I'm in trouble. Okay. I have to go in to see the doctor. But usually that's too late.
Definitely is asymmetrical.
Yeah.
And it's pretty dark. When one has melanoma, like in this particular case, is it just that one spot?
Usually it can arise out of a pre-existing mole. So you could have a mole for 20 years and it looks completely fine. And then literally overnight it could start changing. It could get bigger, darker, start bleeding.
That's what we have
then you have to call your dermatologist right away.
Okay.
You should not wait for it to look like that picture.
Right.
Yeah.
Okay,
you
so
should try to catch it early. That's a very advanced case.
Okay, let's take a look at the next shot. This is just a little bump on somebody's forehead?
Yes, and you could very easily mistaken that for a mole or even a pimple. Basal cell carcinoma oftentimes starts out by looking like an insect bite or a pimple or a zit. And they are little pink little bumps. The difference is if you have a pimple, it's probably going to go away. Skin cancer will persist and continue to grow.
So this would not go away?
This will not go away.
Okay, next one. Wow, what is that?
Yeah, that lesion is, it's very advanced squamous cell carcinoma.
So is it the dark brown spot that we're looking at, or the entire red?
Well, the whole leg is inflamed. These skin cancers,
Wow.
oftentimes, if they start to grow, the skin around it can also start to
Wow,
change.
I've never seen anything like that. That's amazing. And what does this show?
That is also a basal cell carcinoma.
Now, basal cell, I understand, is the least, I would say, least lethal.
Correct.
Skin cancer?
It is the least dangerous.
Least dangerous.
It normally does not cause death, and people who have it, very treatable, especially when caught early. It's not going to cause a huge scar even. These do not spread, so people don't die from these.
Okay, and this one is?
That's a melanoma.
And that's a melanoma. So it's like the one that we saw at the very beginning. It's a low dark spot, it's oddly shaped, and so I would say this is relatively advanced because of the size and
Yes, it could. Sometimes from the moment a melanoma appears, it can be very aggressive. There are slow-growing cancers and there are fast-growing